Alright, next I'm going to show you the oblique for the ribs if you do have an anterior injury of the ribs. So say we're doing bilateral ribs and we take our first image with the patient PA. Okay, for the straight PA you would have the patient's chest right up against the board. Then you would put your cassette in crosswise if they are of any width throughout the chest. And this would be our PA position for the ribs. Okay. Alright. Next, if we were doing the obliques of the ribs, alright, what we have to keep in mind here regarding the PA obliques is the side that you are going for is going to be the side that is up or farther from the image receptor. So if I am going for the right ribs and I'm doing a PA oblique, we're going to have the patient turn 45 degrees and they're actually in an LAO. The right side is farther from the image receptor, but in essence, it's giving you the same projection as if you're doing an RPO. But always remember, PA obliques, the ribs are going to be farther away from the IR. So since we're going for the right side, I'm going to put my right marker up here in the corner. Okay, then you want to double check and make sure that the longitudinal line is halfway in between the spine and the lateral border. So that is our halfway point. Okay. Then you check, this line will be cutting across the inferior tip of the scapula. So this is our oblique film, and again, since we're going for the upper ribs, you're going to do this on deep inspiration. So to do the left oblique, or the left ribs, we're going to get the patient in an RAO position. The left side is farther away. The patient is at an angle of 45 degrees. Okay, our longitudinal line is going to fall halfway in between our lateral border and the spine. So there's our halfway point. Transverse is going to cut across the inferior tip of the scapula. And since we're going for the left side, we will place our left marker right up here in the corner. And again, you would do this on deep inspiration so that you can see more ribs above the diaphragm. Okay, one more note I'd like to make is regarding the lower ribs. When you're x-raying lower ribs, you would still do this in an AP position because the bottom two ribs are posterior. So to see those the best, you want to get that area closer to the image receptor. So again, I would bring this down to the level of his crest and then move the tube to meet that. And I'm going to go ahead and put the image receptor crosswise so that I know that I won't be cutting off either side, especially if this is a patient that has width to them. Okay, so with the lower ribs, you'll have them take in a breath, blow that breath all the way out, and then you would hold it out. And again, you would place your markers accordingly to the side of the body. So when it's AP, we're looking at, this is the left, that's the right, so place your markers accordingly.